Well, research methodology is how you go about collecting your information. So how you go about gathering your data, and there's a whole lot of different ways you can do that, but it depends on if you're after qualitative data or quantitative data. So some of the things you might do if you're after quantitative data, which is about measuring things and counting specific things, is that you might use a questionnaire. That's often used for surveys. A questionnaire can ask questions about specific things, normally with predetermined categories. How much money do you earn? How long do you spend watching TV? You know, those sorts of questions. Qualitative research is more looking at opinions, how people feel about things, beliefs about things. And so generally the way you want to collect your information to find out how people feel about things is perhaps by talking to them. So you might want to do some interviews with people, or you might want to run some focus groups with people. And a focus group is a fairly common technique to use. You bring a group of people together, maybe 7 people, sort of between 7 and 10, and you get them to talk about whatever it is that you want to find out about.
Well, I think research is part of everyday life. Whether we know it or not, when we go shopping, we're looking at what is the best value for money, we're doing investigations, so research actually forms part of everything we do. And research really is about inquiry, looking at the best ways of delivering the highest quality education. For myself, I teach nursing. So nursing is embedded with research. We look to deliver the best possible care we can for our patients. So inherent within nursing is a research-based practice. We then can apply that to education into the best ways of delivering information, teaching our students, giving the best possible education to students.
Methodology in research is really how the person doing the research is carrying out the research. A number of methods. There's questionnaires, which is surveys, sending out postal surveys or television surveys. There's interviews where you actually sit down and interview somebody. Observation, where you might go to a playground and observe people in the playground of doing, the teachers do that sometimes, they go observe students and what they're actually doing. Diaries, secondary research is quite popular. That's where people, you read material what other people have done in your area and you make some analysis based on that secondary research. So again, a bunch of, each usually has advantage and disadvantage. Like advantages for questionnaires would be they're cheap to do and you can send them out to a lot of people, but a disadvantage is sometimes you get low return rates and you're never sure who's filling out the questionnaire. Interviews, advantage, you can usually get in-depth information and you have some control of the conversation, but sometimes the disadvantage possibly they're quite hard to set up and you can't do so many of them. Okay, and one of the things you need to consider when your methodology is how you can analyze all the information, because the interviews which are qualitative information sometimes are a lot harder to analyze than questionnaires where you could use Excel or SPSS. You know, you can use some type of computer software to analyze the information. So with methodology, it's how you carry out the research, and you have to think, depending on what you're researching, the method that sort of suits you best.
While carrying out research, students have a huge responsibility to maintain a high level of ethical standards. Ethics are very important within research, as the researcher is in a place of power over the subject or person that is involved.
Well, ethics is very important in research, and ethical issues arise because researchers are in a position of power. So when you go and you gather information from people, you are invading their lives and you're in a position of power over them, really, because they're giving you their personal information. So ethics are there to protect yourself as a researcher and also to protect your participants, so the people that you're collecting information from. So there are 12 basic ethical principles, and probably the most important ones are things like informed consent. So what that means is that the people who you're collecting information from, they need to give you their informed consent. So you need to give them enough information so that they know exactly what it is that is required of them and what will happen to the information that you get from them, and they need to consent to that. So there are 2 crucial pieces of information you have to have whenever you collect data from people, and one is an information sheet which clearly explains what is expected of them, and the second is a consent sheet, and that is signed by your participants, and you give them a copy of that, and it explains everything to them so that you know that they have understood what is expected of them in your research.
I'm very much from the baby boomer generation, giving an indication that I'm a bit older. So we very much accepted that research that was done, say, in the 60s, 70s, did not go through the same ethical procedures that are required now. So I think in the baby boomer type generation, we might have been subjects of research that we were totally unaware of because there wasn't that ethical rigour. Now, anybody that participates in any sort of research project has to be aware that they are part of a research project. So consent has to be given by all participants. We have to know what harm could be caused. There are issues of confidentiality, honesty, integrity. So if our students were part of research, they would be very aware of that. Coupled with that, of course, is once people are aware that they are involved in a research project, people's behaviour will change, and there's something called the Hawthorne effect, which shows that once you're part of a research project, because you are aware that people are taking an interest in you, then behaviours change. So just a little bit more awareness of the research that is going around happens today rather than sort of 30 or 40 years ago.
Ethics really involves, that's the sort of the principle or values about especially when you're working with people, and that would include things like confidentiality, that somebody, when you print up your the analysis of your data, that people aren't able to be identified, the right of refusal, that if somebody doesn't want to take part in the research, that's their perfect right. A big issue might be with children, that you need to consider that with children, legally you need to get parental permission. Or if you're doing it in a school, you need to get the permission of either the Board of Studies or the school. So ethics really deals with the values and the morals that you have when you're working with people. It really came out of, historically it came out of after World War II, where there was a lot of unethical things happening in Germany dealing with people. So it has a historical basis. But yeah, so it's really important when you're carrying research that in most cases for research you got to get ethical approval. And that's usually done when you actually write a proposal. So it's really important that if people are doing research, that they realize that they will need ethical approval for whatever research that they're actually doing.
Okay, I mean, if we were actually going to do research with our students, that has got problems. And the biggest problem that you have doing research with students is the power base. So for instance, if I wanted to do some research with my students, on my students, there is a bit of a power relationship. And so we have to go through quite rigorous ethics approvals processes in order to conduct research with students. The other thing we do in nursing is obviously look at research-based practice with our clients, with our patients. And again, if we're going to do any research with clients, that also demands quite a rigorous ethical approvals process. So in order to conduct research, there are quite a few hoops to go through in order to conduct research. So what we tend to do more is look at what research has been conducted and apply that to both the classroom and then to our patient care.
Any research that's undertaken, whether you're doing undergraduate research or if you're doing postgraduate research in the form of doing your master's or a PhD or postgraduate study, you always have a supervisor, and in some cases you have more than one supervisor. You might have 2 or 3 supervisors. So that supervisor is responsible for guiding your research, really, making sure that you're making the right decisions about what methodologies you might use to collect your data, making sure that you understand fully all the ethical principles and that you are following them, directing you, making sure that you are on the right track, reading drafts of what you've done so far and making suggestions about that. All of those sorts of things are part of the responsibility of the supervisor.
If you're writing a proposal and you don't have a good ethical basis, or you're not going to carry out the ethics, the proposal won't be approved and you won't be able to follow you won't be able to carry out the research. So ethics is really one of the backbones of, I mean, you need to protect the people that you're going to be doing the research with. I mean, you wouldn't want somebody to sort of give you some bad drugs or something like that and then made you sick and stuff like that because they weren't, because the project wasn't correctly supervised or they're carrying on ethical practices. So ethics is really important.